Well, just got called for a delivery, so I'm heading into McKay to catch a baby. And there was something I want to talk about today, nausea in pregnancy. Mostly by about 9 weeks of pregnancy, if you're going to get it, you've probably got it. Have some vomiting to go with it. Hopefully not worse than that, where it's just severe, debilitating, you're losing weight and all that. But if it's just mostly nausea and some vomiting, then there's some really simple things you can do. And I'm actually going to swing by Smith's on the way home and show you where you get this stuff. I've told a lot of people about it. But just to sort of give you a visual aid on what you're looking for. So we'll do that in a little bit, just after this baby's born. So we'll touch back shortly. You know, it always seems like when I'm going in for a delivery that there's a person driving like 2 miles an hour through my neighborhood and I cannot get around them and I have to wait. This person's going so slow. Nothing against them. They're just probably out for a Sunday drive. And question 2 is somebody's in labor on the weekend like this when I'm on call. What are you doing? Well, I exercised this morning. I didn't bore you with any video of that. I'm still training for that marathon, which is coming up in about a month, so I'm still working on that about every day. And then I'm just waiting for the call, which fortunately just got, and so heading in for delivery. And I live just up the hill from the hospital, so it's really convenient. Gonna go deliver this baby and then I'll be right back out and we'll go to Smith's and find some stuff for nausea and pregnancy. See you in a few. So the baby's here and now we're gonna go to Smith's. It's just around the corner. You guys see all that snow up there on the mountains? Won't be long. We'll be skiing. Okay, here we are. We're at Smith's. So, it's here at Smith's in the bulk food aisle. It's the first thing that you want to try when you're nauseous. And that's ginger. So about 25 calories a slice. It's not too bad. That stuff can really help. So the ginger, you can take it several times a day, just kind of nibble on it as needed. And that's a good one. You can just throw some in a Ziploc in your purse, have it with you in your backpack, whatever. It's good to go. I've used it for motion sickness myself and I think it really helps. People look at it like I'm crazy here. Now the other one is in the vitamin aisle. We're looking for vitamin B6. Not that one. I hope they have it. It's going to be kind of a bummer if they don't. B6, bam. Okay. Vitamin B6. This one's 100 milligrams. There may be some 50s here somewhere. Okay, well it looks like they only have the one brand here at Smith's of the B6 100 milligrams. So you could do a quarter to a half of one of those 2-3 times a day. And you're going to take that with some Unison, which should be around the corner. Ginger root. Doesn't tell you the dose. 125 milligrams. Ginger, 125 milligrams four times a day, but that's usually as like a little little liquid extract, so I don't see that here. We'll go around the corner and find some Unisom. Okay, and then Unisom, that's diphenhydramine. It's not the right one. That's just Benadryl. Okay, this is the one you want right here. That's what you want. So doxylamine, that's what Unisom used to be. Unisom, name brand Unisom is Benadryl now, who knew? So just get the generic doxylamine. And the Kroger brand, that's what it looks like right there. 25 milligrams. Take that at bedtime. So you do your B6 twice a day, 3 times a day, something like that. The doxylamine at night. There is Unisom sleep tablets, and that's So Unisom tablets are still doxylamine, but the sleep gels are Benadryl, which may have some anti-nausea effects, but the data is really more on doxylamine, so that's the one that I would get. All right, there you have it. Still, check out those mountains. So just got another call that another baby's gonna be coming soon. So maybe we'll just finish up this talk right here while we're waiting on a baby. So if you're doing small frequent snacks, make sure you're getting plenty of rest. I forgot to show you those C-bands things at the Smiths, but there's not a lot of data that really help. If it works for you, great, do it. But the data is just really not there in any kind of large way to say that they're of any benefit. I kind of usually forget to mention that one. But if you're doing all those things and it's not working, then you're talking about prescription medication, especially if you're starting to lose weight. So then you start thinking about either promethazine, which is Phenergan, or Zofran, which is ondansetron is the generic name. And Phenergan's fine, it's been around forever. It just mostly it makes you really sleepy. That's the main issue with that one. And for a lot of people, they're just too sedated to use it during the daytime. It's just not practical. But at night, it's good. So, maybe take one, go to sleep, and get some rest. That always helps too. But if you're doing all those things and it's still not working, then Zofran is still acceptable to use. There's some data on Zofran. It's conflicting. And I think the gist of it is that there's no definitive evidence that it causes any kind of birth defects. There's a couple studies that showed maybe slight increased risk, an association with cleft lip and palate, and some heart defects, but other studies haven't shown that, and more recent studies have not confirmed it either. So again, I think that if there is a risk, it's very, very small. And if you're talking about somebody who's losing weight, dehydrated, they've done all the things they're supposed to do, nothing's working, probably at that point you're getting IV fluids and having to come in the office for evaluation and maybe go in the hospital and stuff like that. Well, I think it's a no-brainer at that point. It's reasonable to use it. But it's just not the first thing I would do. It's like, yeah, you feel nauseous here, take some Zofran. It wouldn't be the first one that I would pick. But if you've gone through everything else, I think it's very reasonable. And I would just try to use the lowest dose and as least frequently as possible, mostly because the side effects can be kind of bad. So headaches, constipation are the main two that you see the most of. So those can be an issue for people who are taking Zofran. Well, hopefully that didn't seem too herky-jerky. During the course of making this video, I did 3 deliveries, and so a lot of in and out of the car, jumping back and forth to the hospital between visits to Smith's. Also managed to make 6 smoothies during this time, so I am the smoothie king. Okay, so that's the long and short of it on nausea in pregnancy. Hopefully you find that information helpful. Basically, you can start the ginger, the B6 Unisom on your own. You don't even have to wait till you come in to the office for a visit. You can start that stuff up at home and hopefully not have to suffer until you get to your visit when you can finally get the information from us. So start those up right away if you're feeling crummy, and then let us know if things aren't getting better. If you feel like you're just super dehydrated and not going to make it even till the next day, then you could always go to the emergency room for some fluids or to urgent care. Although in our office we can do fluids during the daytime. You can just call the nurses and they can hook you up. So that's not a problem either. So basically, this is one of those things you don't need to suffer with. There's lots of tricks and lots of different things to try. So give it a shot. Let me know what you think. Hope that it works, and hope you feel better if you're feeling nauseous right now. And take care. We'll see you soon.